Pledge of allegiance. Flags located over Holly. I pledge allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Chris Buckman.
Here.
Brandon Earl.
Here.
Andre Greifels. Here. Jason Newberry.
Here.
Deanna Garber. Here. Tom Henning.
Here.
Pat Zika.
All right. First off, I want to thank everybody for kind of adjusting their schedules. Hopefully this will kind of be a short, sweet meeting just to kind of address some of the changes coming from the CDC. So thank you all. Any patrons or staff sign up? Adam?
Agenda first.
Oh,
Jason.
sorry. I skipped adoption of the agenda.
I'll make a motion that we adopt the agenda as presented.
I'll second.
Got a motion and a second. Any discussion on that? Seeing none, all those in favor raise your hand. All those opposed, same. Okay. Any patrons or staff, Adam, that sign up? No. Okay. Okay, looks like the only thing on the agenda is the USD 353 Safety and Operations Plan.
Yes, so sent you lots of information to review over the weekend. As you can see, we had a pretty rough week in our schools as far as positive cases. There's a pretty big wave rolling through our community right now, and so I want to thank Holly and her staff for, I know they were running around with their heads cut off the way we are currently doing testing and setting things up right now. And so I want to thank them very much. In the middle of the week, we received new information from KDHE on recommendations for schools moving forward. And that also included some testing options. What we've been able to do in the past, the way the safety and operation plan is set up, is we have been able to take things directly from the CDC, and anytime there's been changes, and attach those directly to that. And so it's not something that the board necessarily has had to meet on in the past. It's something where we've automatically just been able to put it in the right spot and continue to follow things as presented. And in this case, KDHE has given options as far as our testing program. And we have some issues going on with our testing program right now in that we follow the test to stay program to the T, which means that all close contacts are tested within our schools in order to stay and continue to learn. And a couple things we're running into there is the tests that are available. This is becoming a problem across our country. It is becoming an issue. So we were just actually told by KDHE, who does send us our tests, that we're now getting tests and we're asked to ration those tests for a certain period of time. So I believe the last box, and really Holly's the expert on all this, so I'll let her talk, but the last shipment we got, we were told this is the amount you have, and because of the shortage of tests, we need you to make it last through this certain date. So they're starting to ration test out. At the same time, we have a wave coming through our community, which means the way our current testing program is set up, we are using massive amounts of tests every day as we test all the close contacts that are connected to the positive cases. As you saw in updated numbers this week, we had lots and lots of positive cases this week, which means lots and lots of close contacts to test. So what we are recommending in your USD 353 medical recommendations document is that we do move to the latest close contact isolation guidance that is provided by KDHE, but that we also move our testing program because of the number of tests available. I know Holly did talk to the medical panel this week, and although the test to stay program, which we are doing currently, is obviously better for being able to know perfectly what's going on in your school, or the best you can anyway, being able to move to our medical staff being able to just do basically their discretion, their medical discretion as to trying to test people who they feel are in a need-to-know situation. Possibly people who they suspect, or also people that also are close contacts to people that do have significant medical issues that they're aware of and other things like that. So because there were multiple testing strategies put out there by KDHE, we wanted to make sure the board got together to make sure they were comfortable with moving in a different direction with our testing strategy for our schools. So I appreciate everybody's flexibility being here today. Holly, I don't know if you want to add to what you've been seeing and.
Well, and I think Adam had kind of touched on most of it. Obviously, our numbers are higher than they've ever been. Also, our absences are higher. So there are a lot more cases out there that either haven't been tested because the doctor's office are just saying, we presume you're positive, whether it's because there's positive cases in the house or just with the symptoms and they're running low on cases or on tests also. So they're not necessarily testing. And then, so I did also get an email from our contact at KDHE that sends us tests on Saturday. They actually are having to go to a different vendor now to get those tests. So we have to send in another email for how many tests we want that they'll send out for. So the tests we have to get us through next Friday. And then the next shipment will have to get us through the end of January. So hopefully they'll get us that long. They didn't tell us exactly, how many we can have. The last time when I ordered, she did limit us to how many we could get. So I'll see what that limit is. I haven't put that order in yet. I wanted to see what you guys decided today before we put that in.
So questions for Holly regarding anything that's going on or her recommendations to move forward? Like I said, when we did talk to the medical panel this week, Holly can speak to this, but they obviously feel the Test to Stay program is better as far as actual knowledge, but obviously they're also experiencing testing shortages within their, at the doctor's office and other places. So they understand that this is, kind of what unfortunately has to be in order to try to ration tests and use them in times that our medical people feel is appropriate.
Questions, discussions?
I have a question. What are we doing about contact tracing? Because I've heard, and I thought I read something here about contact tracing. Isn't it changing because, explain what we're doing contact tracing.
Currently the school does contact tracing, the medical staff does contact tracing. KDHE and the health department have stopped doing, or actually KDHE is going to stop doing that in February. I believe February 1st they are going to stop. And so as part of this, we would also not be contact tracing unless there was, unless there was something that, if we had a close contact that our medical staff knew was near somebody who, could be, had some potential health issues with us because of other things that they deal with, and obviously we would want to contact those families and try to be on top of that. So it's going to be more of a medical discretion instead of a full contact trace like it is now.
That's what I'd heard. I didn't. That's what we're doing too.
Yeah. Is that right, Bob?
Yeah, and there are different options with that, whether, if we test somebody here and we know they're positive, obviously we can send a letter out that says, hey, somebody in your kid's classroom tested positive. Or if we, depending on what we decide today, obviously we send information out to the community where with the spread the way it is, you pretty much know your child at the moment is a close contact just because of our high number of positive cases. Chances are everyone's getting exposed right now just with the number of cases between us and in the community both.
Holly, can you explain the 5, 7 day, 10-day thing? Because I've heard a lot of kind of people struggling to kind of understand that whole.
Do you mean the quarantine isolation, like the testing?
Yes.
Testing?
Yes.
So what they propose that we change to for testing is test on, if they want for like what we're currently doing, we test as soon as we test when we find out, and then you test through day 7 every day. With the shortage of tests, and they want us to switch to every other day testing. So you test when you find out, and you test through day 7, but you would just test kids every other day. But you would have to get 3 tests in there, and you would have to make sure that one would be after day 5. However, if you're running super low on tests and there's a danger of running out of tests, they would want you to test on the day you find out and on another day between day 5 and 7. So that's part of also the problem with staying on the plan that we're currently on, is it would always be changing how you test, and I think kids would be getting missed, there would be mistakes, and that would be my concern, is that, we don't, not that we never make mistakes, because obviously that can happen, but we don't want to make mistakes if we don't have to, we don't want to test the wrong kids, we don't want to miss kids if we don't have to. So that's just part of the concern too, is that that plan has to be ever changing depending on the number of tests. There's a higher chance of you running out of tests when you're doing that because of just the sheer number of kids that are going to be tested with that.
So we're talking about eliminating test to stay.
Yes, and go test it now and put it into the discretion of our medical people.
So that'll be a lot more kids home for 5 days when they're in close contact.
A lot more kids at home for 5 days if they were to test positive.
No, if they're identified as a close contact, will it be?
No, because we wouldn't be contact tracing at the level that we are now, so it would actually be less.
Less kids.
Right.
So,
The only way they would get sent home if they're symptomatic. Right?
The only way we would send them home is they're symptomatic. Now, say somebody in their house is positive, obviously they would be a close contact, so yes, that would keep them home. If their parents call in and say they're a close contact and they need to stay home, that would keep them home. So there are some ways that yes, they would be home as a close contact. We would not deem them close contact. So, and that's the part that obviously I don't like, but on the other side, the other part is just hard to keep going just with the sheer inability to keep up the test, because there will come a point very soon, quite honestly, we wouldn't make it through the week with enough tests to test everybody to finish out the week before we get more.
Any other questions on that? Clarification? Okay. So what do you need from us?
just looking for if the board is okay with our recommendations, then approval of the changes as presented in the recommendation form.
I've got a quick question here. The changes are in the updated close contact isolation guidance?
Yes.
Okay, so the only question I got is down there where it says, well-fitting mask for 5 days, sporting events, and then it says lunch with just a dash.
Yes,
Was
that is
there-
something we would have to work with administration on.
Okay,
Yep, that's gonna be kind of individual by building as we'd have to work with them on that.
gotcha.
Sorry, probably should put that wordage in there.
That's okay. I just want to make sure I didn't accidentally delete a sentence there.
No.
Any other questions or discussion? So I guess I would look for a motion on that if we're wanting to go ahead and move forward with the plan presented, or if there's changes that we want to address, then now's the time to be talking about that. And this is just dealing with the testing portion of it, right, Holly? And as far as our contact tracing piece of it, this doesn't have anything to do with these things at this time. We're staying with the same plan as we were in
Yes,
before, as far as
affect
masking.
it will affect it though, because,
True.
because if we're not contact tracing, then there's gonna be less numbers.
Right. True.
More than
There
likely.
would be less.
More than
numbers.
likely.
Yep, you're right. Numbers would go down.
I move that we approve the updated close contact isolation guidance.
Got a motion?
I'll second it.
Got a second? So any further discussion on that? Seeing none, all those in favor, raise your hand. All those opposed, same. Okay,
Thank you. We will keep you updated on how let's make those changes starting tomorrow, and
so what's the plan as far as letting the parents and public know?
we will get this out to, we will re-release the plan again with the changes in it.
Good.
And we'll make that happen today so that parents are aware going into school tomorrow.
Okay,
I appreciate your flexibility, I know it's a holiday.
that is the only thing on our agenda, so we are adjourned. Thank you all.
Thank you.